Hello, good evening. Yes, you may come in. I believe we have met before. As I vaguely remember, you came the very last day before the new year for a physical exam. Is that correct? Or is my mind playing tricks? Ah, yes. Well, it's a pleasure to see you again. So today, you're not here for a physical exam. So far, from what I'm seeing on my schedule, you're here for a full complex medical exam, which includes cranial nerve, eye, physical, dental, and ear exam. Is that correct? Well, you came to the right place. So I'm not gonna jump into too many details since I know you already. So we're gonna just straight ahead jump into the actual exam. Okay? Great. Of course, if anything bothers you, do not hesitate to share it to me. That's great. So, first, let's do the most important, vital aspect of this complex exam. So first, we're gonna do the cranial nerve exam. I'm just gonna examine generally your cranial nerve and determine if it functions all normal. Okay? Great. So for the first test, I'm just gonna quickly just check your taste. What I'd like you to do is just close your eyes so you don't see what I'm actually putting on your tongue, your receptors. Just close your eyes, close your eyes. Yes, thank you. Not gonna put too much of this potion to call it. Okay, yes, of course, take your time. Yes, it's quite sweet. So, what is this? Ah, yes. That's a maple syrup, of course. You're very much correct. At least, that's what I'm reading here. Okay. And just in case, let's do a second test. Another sample for your tongue. Now what I'd like to do, just close your eyes again so I can put this sample on your tongue. Would you like some more? Okay, yeah, that's good enough. Right. So, what are you tasting right now? Yes, that's vanilla, of course. Yes, it is sweet as well. Here I tend to use anything bitter or salty because those tastes are quite extreme. They could be quite extreme to your tongue, so I'm not gonna experiment with them. That's why I chose the sweet ones, because I think they're they would be the most satisfying to your tongue. Okay, well, you have nothing to worry about so far, as your tongue functions all normal. I haven't noticed any abnormalities. Okay, so now let's test your smell, and for this part, I just want you to just close your eyes again. I'm just gonna put this sample under your nose. I just want you to identify the smell for me. Mm-hmm. Yes. Okay. Yeah, of course. Take your time. Take your time. Right? So, what did you smell? Yes, that's a coconut, of course. It has quite the aroma. Absolutely. Now the next one. Close your eyes. Tell me, what do you smell? Black pepper? Already? Well, that was quite fast. Astonishing. Your olfactory nerve is functioning all normal as well. So now we're jumping to the optic nerve, which is actually included in the cranial and the physical exam in this whole exam, but I'm just gonna focus on the cranial nerve and I'll probably skip it on the physical part. Okay, so I'll just look straight ahead. That's it. Right? Now, I just want you to just relax. I'm just gonna cover one of your eyes. Is it too bright for you? No? Okay. Now, just want you to follow the light. Just simple exercise to check how your eyes are perceiving the light in their field. Oh, I got a little bit too bright. Okay, now stop following the light and focus on this finger. Focus on it. Focus on this finger. Focus, 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 focus. Good. Right? Good. Right, now I just want you to look straight ahead. I'm just gonna go with the light from side to side. Ignore what I'm doing. Just ignore the bright light. Great. Now, just want you to tell me as soon as you see this white light in your field of vision. Great. Good. Lovely. Yes. Okay, yes. Alright. Now tell me as soon as it leaves your peripheral vision. Great. Good. Perfect. Nice. Very good. Alright. Now, I want you to keep your head and eyes still and look straight ahead at me. I have those two hands here. What I would like you to do is just tell me which of them are moving or wiggling. Right? Let's go. Nice. Good. Perfect. Very nice. Now tell me, which is the hand that moves? This one here? Correct. How about now? Can you tell me which hand is moving? Yes, this one here. Good. How many fingers do you see? 2, 4. Great. That's perfect. Now we're actually stepping into the real eye exam. For that, what I would like you to do is just look at this handmade, handmade chart of mine. Now, I would like you to just tell me this number here. Can you tell me this number? 1. Let's continue. 2, 3, 4, 5. How about this one here? Can you tell me this one? Yes, that's 6. Let me just switch sides. Is that comfortable to you? Alright. Can you tell me this series of numbers and letters? Okay, let's start with the first one. What do you see here? Yeah, that's a letter. Read it for me. B. R. What is this? Is that O or 0? Yes, that more like looks like a 0 rather than a O. Correct. Yeah, that's O. But this one here, 1. This one here, C, T, and the last one. No. That doesn't look like B. I don't think that's B. Try again. Yes, that's P. Correct. Okay, I have another idea. Cover one of your eyes and tell me this number here. Yeah, that's 5. And the other eye, this letter here. Lovely. Perfect. Right. Now let's test the focus of your eyes. Look at this marker here. Just look at it and follow it wherever it goes. Wherever it goes. Are you facing any difficulties following the marker? No? Okay, great. Alright. Meanwhile, is there any double vision? No? Okay, good. Okay. Now let's have a more thorough look of your ability to count. How many fingers do you see? 5. Correct. 4. 2. 3. Okay. 10. I tried to trick you right there. Yeah, 0, of course. And how about now? Yeah, that's 3. One more time, okay. 5. Correct. Okay. Right. Do you face any difficulties identifying colors? Okay, that's great. Now I would like you to just look at this object and tell me the color. Yeah, that's green, absolutely. How about this fidget spinner I got here? What color is it? Yellow. Awesome. What color is this tie here? Yes, it's quite elegant. And it's blue, of course. Very nice. Good job. Right. Now, let's test your motor functions. I didn't include this test in the cranial nerve because I want to do this motor function test individually, separately from the other tests, from the other elements. Okay, now what I would like you to do is just hold still and at the same time relax. I'm just gonna test your motor functions. This may feel weird, but don't worry, it won't hurt. Any pain or discomfort? No? Okay. Okay, this might seem and feel a little bit stranger than the usual. I'm just gonna tap on places of your chest. Raise up your clothes. Thank you. Any discomfort? No? Okay. Let me just continue with your legs and your feet. Okay. I haven't noticed any weaknesses with your muscles. But now, what I would like you to do is just do some tests with me. I would like you to just spread your fingers like this, and don't let me squeeze them together. Wait. Okay, good. Now the same thing with the other hand. Wait. Okay, good. Now, just want you to push up your shoulders, and don't let me push them down. Fight real hard. Okay, good. Now I just want you to make a frown. Good. Now make a happy face with a smile. Okay, good. Okay, now I just want you to act like you're surprised. Great. Okay, now I just want you to close your eyes tight, as if you have to open them, and don't let me open them up. Wait. Okay, good. Now just grip my hands. Good. Yeah, grip them really hard. Okay, good. Now, I'm just gonna stroke your palm and look straight ahead. Ignore what I'm doing. Same thing here. Now, I'm just gonna tap under your mouth, on your jaw. Just let it hang. Yeah, just like that. Okay, good. Okay, good. Now for the physical exam, I'm just gonna have a listen of your bowels and your breathing. Just relax. Breathe in. Breathe out. Breathe in. Breathe out. Now let's check the condition of your bowels. Breathe in. Breathe out. Breathe in. And breathe out. Good. Let me just check the back. Breathe in and breathe out. Okay, good. That's enough. Alright. Since you have been talking to me through this whole time, I think we're gonna skip the general appearance test, since I haven't noticed any abnormalities related to the way you're talking and perceiving what I'm talking. So now I want you to remember those 3 words: Chevrolet, zebra, and honesty. I'm going to ask you about them in just a little bit later. Now, allow me to have a quick look of your teeth. Now just relax, open up your mouth. Okay. Any cavities? Have you ever suffered erosion of the enamel? No? Okay. Oh, you can tell. No problem. What I think is that your teeth, nothing's wrong with them. This is the 3rd year. How about here? And here? And here? And here? And here? Good. Okay. So far so good. I haven't noticed any cavities or any erosion of the enamel, so everything is good with your teeth. But now, before I step into the ear exam, just wanna have a quick look inside your mouth, your tongue, and specifically your throat area. And for that, just want you to just hold still and open up your mouth. Say ah. Right. Ah, yes. Overall, your mouth, the inside of your mouth is looking good. Now, let me see the tongue. Right. Now, let's move to your throat. Let me just have a look. Okay, doesn't look like sore. Oh, you seem to have removed your tonsils. Well, I'm not gonna question this. I'm pretty sure there's a good reason for that. But everything else seems to be looking absolutely fine. Right? Now, what I would like you to do is just focus. I just want you to focus. This one is vital. So now, I would like you to repeat after me. I'm gonna whisper a series of numbers and letters, and I just want you to repeat what I tell you, okay? Good. 1, B, 2, C. What did I say? Yes, 1B, 2C. Good. Now, once again. 5, F, 6, C, 7, B. What did I say? Yes, 5F, 6C, and the last one, the last combination. Yes, 7B. Correct. Alright, now I just want you to just close your eyes once again. I'm gonna do some soft noises to each one of your sides. I want you to tell me from which side I'm doing the noises, the soft noises from my gloves. Huh? Which side? This one here? Correct. Yes, this one here? Good. How about now? Both of the sides? Correct. Hold still. I'm just gonna have a quick look of your ears. Yeah, I'm not noticing any build-up earwax. Right? Yeah, this side looks good. The inner and the outer part. Let me just have a quick look here, just to be sure. Yeah, same thing. Right? Now, I would like you to just close your eyes and tell me as soon as you don't hear the soft noises I'm making, okay? Right, so let's start. Are you hearing it? No? Good. Alright, tell me as soon as you don't hear it anymore. No need for me to give you a sign, okay? Good. And one more time, just to be sure. Nothing? Are you hearing anything? Good. Okay. Alright then. So, of course, how can I forget? What were those 3 words you were supposed to remember? Alright, let's see if you can remember those 3 words. Yes, Chevrolet, this is the first word. We got two more. Yes, honesty. And let me give you a hint about the last one, since you're struggling. Okay, so we're talking about an animal in Africa. It's like a horse one which drives. Yeah, of course. I've already told you way too much. Yeah, that's a zebra. Of course. Yes, those were the three words. Well, I had to give you some hints, but overall, you did a great job. Well, I could have a look of your facial muscles and your scalp, but I feel like with them there is nothing abnormal. The situation is normal there. Are you having any scalp problems, any dandruff, or are you having any hereditary problems? No? Okay, well, that's great. Well, you can schedule an appointment for a scalp check, and the next time you come, I'm gonna give you a nice scalp check. As for your facial muscles, since you did the facial expressions, I haven't noticed anything weird or strange or out of the normal. So I guess we're gonna stop right here. So to summarize the whole examination, I can conclude that everything we have done so far, all the tests have showed that your whole body is functioning all normal. The organs of your body seems to be working absolutely fine, and keep up with the same spirit, you'll be fine. Okay? That's great. Well, do you have any questions? No? Well, that's great. Feel free to schedule another appointment for another examination if you'd like, and I'll be here in my office. It has been a pleasure. I hope you have a great evening. Bye. See ya.